देव महेश्वर गुरु साक्षात परम ब्रह्म तस्मै श्री गुरुवे नमः. Respected guests and resource persons, respected all the professors and the teachers and all the participants of the state and outside the state, we are very much fortunate that today's topic, which is on this corona, which has actually a cloud which has eclipsed the entire humanity. It has challenged the very survival of the people of the world, and we all are confined to home, confined to house, confined to Zoom. Our near and dears, they are suffering from COVID-19. Friends, Tika Foundation is organizing this international webinar on the role of Ayush in managing COVID-19 in the present scenario. The topic is a burning topic. Tika Foundation is an association, is an organization of eminent scholars, researchers, and professors. Tika Foundation came into existence in 2012, and it is working sincerely for promoting the teacher education. Tika stands for Teacher Education in the Era of Knowledge Application, Tika. And this organization was imagined by an eminent education lecturer and his student, education student, who is the chairman of this organization. He initiated this organization. Now we have eminent scholar and researcher, Professor Subhash Chandra Panda, the president of organization. We have with us the chairman of organization, Dr. Manjuru Ali, who is the founder, who is the source, who is the student of education. And we have the secretary of Tika Foundation, Dr. P.K. Mahapatra, Prasanna Kumar Mahapatra, who was the lecturer at the time. Now he is the reader in education, working in Salepur Autonomous College. And he was the man behind inspiring the student to organize. This is such a very beautiful platform for the youngsters, for researchers, for professors. Tika Foundation has come up with innumerable publications. Tika Foundation has a journal. It has a mission to organize national and international webinars, seminars, and also educational tools. Friends, in this COVID-19, we have already organized a lot of webinars. Today's webinar is a byproduct of Professor Devaprasad Das' imagination, and this is the Ayush, which stands for Ayurvedic, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. These are the 6 medicinal practices which were there in India, and these traditional practices are being used as Ayush, the modern treatment. We have eminent scholars. We have with us Professor Dr. Lakshmipriya Dei, and who is the professor and head of obstetrics and gynecology in the department of Ayurveda in Ayurvedic University, Jamanagar, Gujarat. We have with us Professor Rabinaran Tripathi, who is the professor and the vice principal of Amrita School of Ayurveda, Amrita Vishwavidyapitham, Kolam, Kerala. Professor Anupama Patra, who is a professor END and in Salya and SGT University, Gurgaon, Haryana, and Dr. Prashant Kumar Sahu, Department of Ayush, AIIMS Bhubaneswar, We have with us Anna Jeseva from Petersburg, Russia. We have Professor Shiva Prasad from Professor of Panchakrama, Government Ayurvedic College, Patna, Bihar. Mrs. Kalara Idko Ramshe, Budapest, Hungary. And we have Mrs. Rini Agrawal, who is a yoga expert from Kotak. And we have with us Professor Debaprasad Das, who is a professor of Gopamandhu Ayurveda College, Puri. Dear friends, it's my privilege. Now I am to invite Professor Dr. Subhash Chandra Panda, who is the professor and who has patronized this Tika Foundation when he was the principal of RI Bhubaneswar. We imagined there when we gave the name of Tika, and we bow down before Professor Subhash Chandra Panda for his contribution for Tika Foundation. Now I invite Professor Subhash Chandra Panda, President of Tika Foundation, for his brief welcome address. Now I invite Professor Panda.
Thank you, Dr. Chaudhary. I am very much glad today that Tika Foundation is going to conduct a webinar on Ayush. Let me, at the outset, congratulate our chairman, who is the spirit behind all these movements, and the secretary, who is the real workforce behind this movement, and the vice president and the executive members of this Tika Foundation, who are contributing their efforts to make all these endeavor in this regard to conduct the webinar in different aspects of education as well as life. I am very much glad today that Tika Foundation is going to conduct a webinar on Ayush. And now, at the outset of this COVID-19, it became Ayush treatment became a source of inspiration to many people, because we have not yet developed the medicine to prevent this particular pandemic. Though recently the 2DG is there, but it is not within the reach of the people, neither we have got its impact in our society. I hope it may have a very good impact in our society. But today we are having 9 very famous resource persons from different parts of the globe to discuss on this issue, where when everybody is looking at Ayurveda now for the treatment of Ayush, for the treatment of the COVID-19, I hope today this discussion will be able to focus some light in the prevention and treatment of this particular pandemic. And I feel that we must be very much grateful to our resource persons. I will not take much time. Just I am going to express my thankfulness to our resource persons who are going to enlighten us through Tika Foundation about the treatment and the prevention of this particular pandemic, which will be a milestone in the field of treatment of this particular disease, which has created a havoc globally. Thank you very much. I welcome to all my resource persons. I am thankful. I express my thankfulness to the participants, those who are present here. I request them to please note down their questions when the resource person will be presenting their issues, so that at the end of the program, there will be a very fruitful discussion or questions or session. And with this, I just request my resource persons to initiate the discussions. Thank you very much. Jai Hind.
Thank you, sir. Thank you very much, sir. Thank you for blessing us, for by giving the encouragement. We are thankful to you, sir, for your kind words. So we have with us the chairman of Tika Foundation, Dr. Manjuru Ali, but Dr. Manjuru Ali never speak, never come to the forefront. And thank you, Dr. Manjuru Ali. I know that you are with us, but I will not invite you for giving your talk. Now I invite Dr. Prasanna Kumar Mahapatra, who is the secretary of Tika Foundation. Dr. Prasanna Kumar Mahapatra, who is the reader in education in Salapur Autonomous College, Cuttack, Odisha. So now I invite Dr. Prasanna Kumar Mahapatra to give his report as the secretary very briefly. Dr. Mahapatra.
Namaskar. Namaskar to all of you. Daily we are organizing an international webinar on the theme that is role of Ayush in managing COVID-19 in the present scenario. For this webinar, we have with us great professors and doctors from various departments of Ayush. Really, they will highlight different aspects relating to COVID-19, how we can manage our lives. In this webinar, we have with us our chairman, Dr. Manjuru Ali, the Honorable President, Professor Dr. Subhash Chandra Panda, the Vice President, Dr. Saroj Khan Chaudhary, and honorable resource persons like Anna Jaiseba from Russia, then Clara Idkorumse from Hungary, Professor Lakshmipriya Devi from Gujarat, Professor R.N. Tripathi from Kerala, Professor Anupama Patra from Haryana, Dr. Prasanta Kumar Sahu from AIIMS Bhubaneswar, Professor Shiva Prasad Rath from Bihar, Ms. Reddy Agrawal from Cuttack, and Professor Dr. Devaprasad Das from Puri. So I must invite first Ms. Anna Jaiseba from St. Petersburg, Russia. She is presently working as permaculture designer and an educatorian of Russia, Europe, and India. She is also working as the landscape designer. Also, she is working as landscape designer for ISKCON also. And she will speak on the role of Mother Nature in COVID management. She will speak on the role of Mother Nature in COVID management. So I must request our honorable speaker, Ms. Anna Jaiseba, to give her speech. Ms. Anna Jaiseba. Ms. Anna Jaiseba, please.
Please go for next. Sir, Vasan sir.
Can you hear us? Can you see us?
Yes, yes. Yes.
Yeah,
Continue.
We are here. So it's my name is Anna. So it said Krishna Kundevidasi, but the spiritual name of Clara Rumsey. So we're on the going from one computer. So that's why you cannot see my name. I hope it doesn't disturb anyone. I'm so grateful and honored to be in the association of person who cares for others, and especially in this difficult time. Most of you are connected with Ayush, so the topic says about this. And so Ayurveda and all natural way of treatment coming from nature. So that's why I see it so relevant to speak about connection with nature. And sometimes when we're so absorbed in something, we think about something really deeply, and we even don't care about what's going on outside. Some person can speak to us in a very gentle and kind way, so with a sweet voice, but we cannot hear that. So in this case, the person have to speak louder, and sometimes maybe wave the hands. So, and still it may not work. And the person who is speaking to us sometimes have to scream and maybe make some strong noise. So, and sometimes the person have to shake us really very strongly, and maybe after that we are coming to the consciousness. So, and I see that the COVID, it's the way how nature talks to us, because we don't hear her voice. We didn't listen to her for such a long time. And that's why she has to talk to us in such a way. And this is the way how exhausted planet, exhausted Mother Earth have to talk to us. So I just wanted to start our talk. So because I'm the first person who is speaking about this topic, I wanted to start with this analogy, and to start with this example how the nature is a person who talks to us through the COVID. So, and most of you are doctors here or connected with treatment, some different way of treatment, and you will relate to another example. So, the body talks to us also. So when we are not enough attentive to our body, and we live unbalanced life, it have to talk to us through the disease. So, and this is the same example which presents the nature in a present scenario, let's say like that. And all these things, so the COVID is only one wave of the huge ocean of problems in this world, the mass pollutions and loss of biodiversity and ecosystem disturbance, and even we destroy ecosystems. We may not see how it influence our life in details, but actually if we study a little bit, we can see how it directly influences our life. And this is much bigger than COVID even. So the COVID, it's only top of the iceberg, let's say like that. So, and again, coming to that analogy, this is the way how nature talks to us and trying to awake so our consciousness. So and the secret how we can overcome the COVID and other problems we have in the world is to renew our relationship with nature and with the divine behind that. So this is the small message I wanted to share with you today. So my small offering to all of you, all learned persons who are caring for others' well-being.
Thank you. Thank you, Ms. Ada Jaiswala. Thank you for your presentation. So next we have with us Mrs. Clara Itkorumse from Budapest, Hungary. She finished ELTI University in Budapest, Hungary as an English, Russian, and Italian teacher. She is the editor, Hungarian language, and Sri Chaitanya Charitamrita. She lived in Scotland for 10 years as literature distributor. She contributed number of articles to Sri Krishna Kathamrita magazine, Hidden Identity of Lord Jagannath, Patitapavan, Most Merciful Lord, then Mahaprasad, then Govardhan Haridas, and so many magazines. She contributed so many articles to so many reputed magazines of the country and abroad. Really, we're lucky enough to speak from her, and she will speak about that is overcoming fear of COVID with Ayush. She'll speak about that is overcoming fear of COVID with Ayush. So I must request Mrs. Clara Itkorumse from Budapest, Hungary, and she is speaking from Hungary. So, Madam, please. So I request Clara Itkorumse.
Hare Krishna, Namaskar to everybody.
Uh,
Good evening, dear professors, ladies and gentlemen, dear wonderful persons who care for others, as Anna said. I would specifically want to thank Dr. Devdas. Professor Dr. Devdas very kindly included us in this event. And for me, it gives me great joy to see how big heart he has and how he's extending himself to others and all of you. And this is such a wonderful thing because most of us in this world have this selfishness in us. And when we at least try to give to others, we try to give to the Lord and we try to give to others, then we can make our first steps in self-realization and in actual happiness. So I was given this topic, overcoming fear of COVID with Ayush. I wanted to speak just a few words about the practicalities of overcoming this fear in practical terms, and a little more about the attitudes, the mental attitudes that are required to overcome fear and successfully navigate during these stormy times. So because you are all doctors and professionals, and I'm an editor, it's not really my field, but because I'm interested in Ayurveda and we did adopt Ayurvedic methods and we have our own experience with COVID, then we can say a few words in practical terms about this. First of all, this fear is a very degenerating sentiment that comes from misidentification with that which we are not. It's coming from identifying, as the Bhagavad Gita says, Bhumi Rapo Nalovayo Kamano Buddhireva Cha Ahankara Iti Yamme Bhinapa Kritirashtada. These 8 energies, these are separated energies of the Supreme. And these, you all know these energies, earth, water, fire, but the mind, intelligence, and ego. This mind, if it doesn't become our friend while we are in this world, then we invite a lot of trouble for ourselves. Because everything which is disease, everything which is manifested in gross matter comes from subtle consciousness. Our present condition comes from our subtle consciousness. Our present manifested body comes from subtle level. And therefore, if we don't take charge of our mind, then it will be very detrimental for ourselves. So this mind can become our friend though. And when we don't make it our friend, then we, by this fear, we can invite disease. And you all know this, you are all practitioners. But when we are, when we are able to,
It's okay.
when we are able to transcend this, then we can successfully navigate through times which are otherwise very scary. So the practical application, some practical advice that you are all aware of, I'm sure, is that all coronaviruses die at 70 degrees, 70 Celsius. So if somebody just steaming with hot water for 3 minutes after being exposed to crowds, after being in COVID environments, it kills the coronaviruses in the throat, behind the nose, that hot water doesn't do, before it reaches the lungs. Simple thing. Vitamins, Ayurvedic preventive medication, everything from Amrita Rishta, Guduchi, Giloy, Neem juice, Tulsi, Ayurkoro, so many things which strengthen the immune system, pranayam, yoga, above all, a healthy and balanced lifestyle, which so many of us do not have in general, unfortunately. These things all help boost our immune system so that we just don't, if we get the virus, we will get over it very quickly. So this is just the practical aspect. If we have a healthy diet, and honestly, you are all dishes. If you just have your mother's cooking, moong dal, alkaline subsies, no sugar or less sugar, no hydrogenated oils, no trans fats. If you don't try to eat like the Westerners do, you will be okay. That's just my. I am from Hungary. A few years ago, with my husband, we went to America because he's from America, and I was trying to find Kokam, Garcinia, in New York. I was trying to find Shikakai in New York. And all these things are there, and they are like $50, $20, because everybody there understands also, not everybody, but a lot of people, big groups of people understand in the West the value of the simple traditional methods. And my strong message today would be, yes, there is corporate systems in the West. There is so much to learn from the West in terms of technology. But if you lose your connection to Mother Nature, if you lose your connection to your tradition, everybody else is trying to find that connection. They are trying to turn to you. They are trying to learn the Indian culture, the Indian tradition in the West. Please don't give up your culture. The way I see it, according to your Vedic literature, this whole pandemic, as Anna Zaitseva actually said something about this, that this is Mother Nature shouting at us. We have been acting in ways which are very, very out of sync with nature and with our own being and with the Supreme Being. So because we are acting in these ways, then there is a reaction for such action. And that sinful reaction, when it accumulates, this is what we are getting. Disease, wars. And this disease is definitely, this pandemic is definitely a war, the proportion it has reached. And this is because we forgot our roots. And if we, again, try to identify with who we are, a tiny, tiny part of the Lord, then the Lord who is Abhaya Charana, whose lotus feet grants fearlessness, then we are able to navigate through this without fear. I have a little story from Mumbai. I have a couple of minutes. I have a little story from Mumbai, from Bhaktivedanta Swami Prabhupada a few years ago, who was the one who took your culture to America at the age of 17. he was walking on the beach with some Western disciples of his, and they saw a big dog, a Western dog, nicely fed, on a nice leash with a gentleman. And Prabhupada stopped, looked at his disciples from the West, and he asked the American disciples, what is the difference between this dog and that little Indian dog, the skinny one there, the scraggly one with a disease? And the disciples looked really bewildered. And then Bhaktivedanta Swami said, this dog is Sanatha. The Indian dog is Anatha. This dog has a master. And because he has a master, he is fearless, because he knows that the master will take care of him. He will feed him. He will prevent him from getting diseases. So this is my message, that you have your Jagannath, your Panduranga, your Srinathji, your Allah, your Jesus Christ and his Father. If you turn to the Supreme who is in your heart and outside as well, and in every single atom and in everyone else's heart, and if we turn to him and become Sanatha, and we have the Lord again, then we are able to navigate through these pandemics. This is my small message that I wanted to share with you. And now I think coming a lot more professional advice, practical advice. Thank you very much. Hare Krishna.
Sir, please unmute your mic, sir.
Presently, few years back, she was the lecturer in ELT University in Budapest. She has left that university and presently she is delivering lectures in different institutions. She has a class for that, for which she has left the webinar. But I request, ma'am, after the completion of your class, please join us for the question and answer session. However, thank you, ma'am, again. Then we have with us a great professor. He is Professor Dr. Abhinay Tripathi. He is the professor and vice principal in Amrita School of Ayurveda, Amrita Vishwavidyalaya, that is deemed to be University, Kerala. He is having the professional experience of 21 years, teaching experience 21 years, both UG and PG level. He is guiding PhD students and PG students also. He is the editorial members of in different national and international journals. He has published more than 100 research papers in national and international journals. He also published a book in German, presented more than 100 scientific papers in national and international seminars and conferences, also organized so many seminars, workshops, symposia, even have done collaborative research projects also. So he has a long experience. He has a long experience in that is Ayush. So we are lucky enough to find such a great professor for our webinar. He will speak on COVID-19 clinical profile and Ayurvedic whole system approach. Sir, I request Professor Dr. Abhinay Tripathi for his presentation. Professor Tripathi, please.
Yes, sir. Yes, sir. Sir, am I audible, sir?
Yes, you are audible.
Okay. So, my humble pranam at the lotus feet of Lord Jagannath. Simultaneously, my pranam to all the organizing committee member of Tika Foundation, Dr. Mansur Ali, Dr. Mahapatra, Dr. Subhas Panda, and Dr. Saroj Kumar Chaudhary. And I should not forget about my teacher, Dr. Dev Prasad Das, because of whom only I have joined in this webinar. So it's a great opportunity and I feel privileged to be a part of this seminar. And thanks to the organizers of Tika Foundation Sir, let me share my slide because I am having few slides to show to all of you. So with your permission, may I please share my slides?
Yes, sir. Yes.
So once again, welcome to all of you. So today my topic is COVID-19 clinical profile and Ayurvedic whole system approach. So clinical profile, what I mean to say, I have to tell about the Ayurvedic understanding of this COVID-19, and simultaneously I will discuss about what are the methods and how we can approach the treatment or management in 3 different phases, like to prevent it, and when there is a full-blown COVID-19, at that time how we can approach and how we can treat, what is the protocol. And so many people are also complaining that they are having some weakness after getting relieved from this COVID-19. So at that time also, what should be the Ayurvedic approach related to that? But before going to that particular topic, here I should say something like the outrage of COVID-19 has put a tremendous crisis on Orissa, not only on Orissa, rather in India and the whole world as well. Even though the vaccine is made available by constant effort of scientists, but still it is out of reach to each individual. And the coronavirus also showing unpredicted mutations. Hence, it seems not under good control. So in that case, all of us are on the verge of life and death. And we always have the news of our loved ones' recent departure that has left us sad. Everywhere you look, today the tide of protectionist sentiment is flowing. But you know that history is the witness, and man has never lost, and we will not lose either. So I would like to request the audience, please mute your mic, otherwise there will be disturbances. Yeah, thank you. So with this strong belief that we will never lose, we can proceed further. Because why I put this slide, because every day whenever we are opening our TV in the early morning, when we are looking to our mobile with some social media, everywhere we are looking that some of the news is there which creates more negativity. And just now you might have heard that Mrs. Clara, she told that how to overcome this fear. So the first thing is the fear itself is the main culprit here, which gives us more tension. And simultaneously, whenever we are looking to the scenario globally, we can see that I have given here the World Health Organization dashboard. By 27th of May, there have been 16 crore 79 lakhs and 58,998 confirmed cases, and around 34 lakhs death is also there. The same thing when we are looking to the scenario in India, starting from 3rd January, because last year in 2020 on 3rd January, there was the first case was detected in India, and till today, till 27th of May 2021, total number of positive cases are around 2 crore 73 lakhs, and total death recorded till 27th May is 3,15,235. So here what I told and what Mrs. Clara told, we have to overcome all these things, and for that a positive thinking is required. So think positive, think good, and it will be good. And why we have to think positive? Because if we are seeing to the scenario of COVID-19, then we can see that approximately 80 to 85% patients will be asymptomatic. and only 10% patient will be symptomatic, 5% will be critical, and the important thing is the death rate is only 1%. That means around 99% of the COVID patient will survive. They won't die. So that is the good thing, and that is a positive thinking. And when we are overthinking is the biggest cause of our unhappiness. So that's why keep yourself occupied, keep your mind off things that don't help you, and think positive. And why I am telling frequently to think positive, because if we are looking into the scenario of death per annum in India, in Indian dashboard, then we can see that because of non-communicable disease, every year around 62 lakhs people are dying. In heart disease, 30 lakhs. In cancer, 7 lakhs. In diabetes, 2.5 lakhs. And because of traffic accident, around 1.5 lakhs people are dying every year. Whereas starting from 3rd January 2022 till now, though it has been already covered 1.5 years, but till date only 3.1 lakh death is there. So that means it's not a big thing that every day some people are dying. It is a pandemic, no doubt about it, but still we have to think positive. Then to understand what COVID is, here I have made one slide, that is, if we are discussing COVID in the way of modern science, then it is an infectious disease caused by the virus which presents with SARS-like sign and symptom, like severe acute respiratory distress. But if we are thinking on the way of Ayurveda, then Ayurveda tells Janapada Dhvansasya Adharma Eva Hetur Bhavati. That means Janapada Dhvansa is referring towards this pandemic or the epidemics, and that is because of Adharma. Other than that, in different contexts, Ayurveda also tells that it is because of Adharma in cosmic level, it is because of Prajnaparadha in individual level, and it is also because of Karma Siddhanta in the individual level. So altogether, these three, like Adharma, Prajnaparadha, and Karma, these three are mainly responsible for this, for any type of endemic, any type of pandemic disease. So if we are explaining about Dharma, what Dharma is, so many learned people are here, so they might be knowing what Dharma is, but still I have given a few examples here, like Dharma is nothing but the moral norms, or Adharma Kayabang Manasa Duscharitam. Even in Manusmriti also it is the verses is there which quotes Dharma Rakhyati Rakshita. Dharma protects those who protect Dharma. And the ultimate aim of life of our Sanatan Dharma, as well as in Ayurveda also it is mentioned that Dharma, Artha, Kama, Moksha, these four are the ultimate aim of life, where Dharma is the first one, and in between Artha and Kama is there. Kama and Artha, that everybody knows, but the ultimate aim is Moksha, to get salvation. And for to getting the salvation, individual health is also important, and simultaneously the health of the masses is also important. So that's why we have to think over it, and we have to make the situation in such a way that not only the individual, simultaneously the whole big settlement of human life should also be in healthy condition. And regarding Prajnaparada also, Ayurveda quotes a very good shloka which tells like Dhi Dhruti Smriti Vimbrashta Karma Yat Kurute Subham Prajnaparadhatang Vidyat Sarvadosa Prakapanam. Whenever there is vibransa, that means there is disbalance, there is disharmony in the Dhi, Dhruti and Smriti. At that time, our conduct will be vitiated. And because of this vitiation of this conduct, there will be vitiation of physical as well as mental humors. So there will be physical, spiritual, mental, physical and social disharmony. And that may lead to illness. Then coming to another slide, that here I can show you that any of the infection is manifested only if agent is able to overcome the host immunity under favorable environment. So that is called as epidemiological triad. Whenever there is an epidemic, whenever there is an infective disease, at that time three things are important, like agent, host and environment. But according to modern, there are some theories like germ theory, theory of susceptibility. So in that, what happens actually in germ theory, they are thinking that the germ is important, host and environment is not much important, they are least. And in the theory of susceptibility, the host is important. So here what happens,